to prevent and treat hair loss. Hair loss is one of the most common concerns for all genders, and while it's often considered inevitable, there are evidence-based strategies to slow it down and in many cases, reverse it. Most hair loss is genetic, known as androgenetic alopecia, and involves a gradual shrinking of hair follicles over time. Early prevention is key. Treatments like topical minoxidil and oral finasteride can help slow progression and promote regrowth when started early, but medical therapy isn't the only option. Platelet-rich plasma or PRP treatments, where a patient's own growth factors are injected into the scalp, have shown promising results in stimulating dormant follicles. Low-level laser therapy and microneedling are also emerging as adjunctive tools for improving scalp circulation and encouraging hair growth. Lifestyle factors matter too. Chronic stress, poor nutrition, and certain medical conditions, including thyroid disorders and iron deficiency, can worsen shedding. A proper medical evaluation is crucial before jumping into over-the-counter remedies. Hair loss can feel deeply personal, but the earlier you act, the better your chances of long-term improvement. A tailored, multi-modal plan often yields the best results, and today there are more options than ever.